Now we go over to the third presentation. I believe is it Pratik who will present?
Good evening, all. This is Pratik from Indian Institute of Management, Ranchi in India. I hope my video is a bit blurred and that would not be much of a problem. So I'm sharing my screen and the presentations.
Thank you, Pratik. Yeah. Maybe I could ask you to could you turn off the background image? It's a little scary.
Actually, it is taking by default the presenter. This entire thing, it is taking by default. So
okay, no problem.
I don't have a green
Please
screen.
feel
That's
free
why
to.
it's happening this way. Yeah.
Okay. But then go ahead and share your presentation, a framework for measuring supply chain quality for a healthcare organization. I look forward to it. Thank you.
Okay. Thanks a lot. A framework for measuring. Is my screen visible? I'm yet to share. Is my screen visible to all? Hello?
Yes, now it is. Thank you. Yes.
Okay. So, as you can see, the topic of my presentation is a framework for measuring healthcare supply chain quality for healthcare organizations. And the slides will go on like this. On slide 5, we will have the research methodology and then how the development of framework took place, what were the steps involved, what are the set of inquiries we made, what all dimensions of quality, and how we are trying to implement the concept of balanced scorecard in this framework. This will be discussed. In slide 9, we presented the final framework that we developed, and then as we go on to slide 10, we will discuss the decision points that we have in this framework and how we are trying to include the dynamic component of, we will explain the dynamic components included in this framework, and then eventually in slide 11, we conclude the entire presentation. So going on forward, why, where, and how. So the key focus of the research is developing a generalized framework to, I'm just sorry, I need to minimize this, yeah. Developing a generalized framework to pinpoint flaws in the existing healthcare supply chain system and strategize the changes required for quality improvement in any given healthcare organization. So basically, for any given healthcare organization, this framework will help them in pinpointing the flaws that they have in their entire supply chain and how can they keep improving it on a regular basis. This is what is the key focus of the research. The suitability in the context to any, it is for any healthcare organization in any geography. And well, in this, the approach that we have taken, we are combining the concept of balanced scorecard and dimensions of quality as applied to a healthcare setup. Moving forward, so introduction. By focusing on performance improvement of a given supply chain, we can ensure quality and enhance satisfaction to the customer. And this is and basically it is, as we all know, that measuring performance is the most important step in the process of process improvement. Hence, we here are focusing on measuring the healthcare supply chain quality so that we can include some improvements and a framework that could identify flaws in the current system. So this is the objective of this entire research. And every healthcare organization has a certain given set of quality metrics, and those set of quality metrics are to be modified on a regular basis because the challenges with the healthcare industry is facing, they are dynamic in nature. So what are the strategies that we can adopt, and what are the strategies that we can define around which these modifications will take place? So this framework suggests them too. Moving forward, how we can develop and add new quality metrics so that we can accommodate all these changes that the healthcare sector is facing on a day-to-day basis. So this is the why around which this entire research revolves, where so the overall supply chain in any given healthcare organization, this framework can be applied to the to analyze the overall supply chain, or else the supply chain of various smaller functional units of a given healthcare organization, for example, the procurement department, etc. At the national healthcare policy, state, district, and gram panchayats, all the healthcare associated with those areas, the disaster management areas also can be taken care by this entire thing, by this entire framework. And how are we going to do that? Basically, we are trying to adapt. There already is the adaptation of Garvin's dimension of quality to healthcare supply chain has been given by Smith et al. So that adaptation is what we have included as a part in our framework. And after that, the concept of balanced scorecard as applied to non-profit organizations. This and a framework was given by Kaplan. So we have, in a way, mixed these two concepts in our framework so as to come up with a unique new framework for analyzing a given the supply chain of a given healthcare organization. So the research methodology that we have adopted is our research objective is to prepare a framework that measures supply chain quality in a healthcare organization. In order to build a dynamically improving healthcare supply chain quality measurement system, we have made a set of 4 inquiries at the initial level to understand the current situation of an organization, and then designing a new set of quality metrics or modifying the existing ones through the use of balanced scorecard concepts and a dynamic feedback system to come up with a better quality matrix that incorporates all possible dimensions of quality. So in further slides, you will see as to how this entire research methodology develops. So first of all, in order to analyze the current, in order to improve upon the current healthcare supply chain system for any given healthcare organization, we need to understand its current situation. And for that, we have suggested 4 inquiries. The first inquiry is about the awareness of the supply chain management system amongst the healthcare employees, the current healthcare employees, how much aware they are about the supply chain management system, what are the various supply chain quality metrics which are being used currently to judge the performance of the supply chain system. Are the healthcare employees aware about that? This is the first inquiry that we want to make, that we suggest in order to understand the current system. And the outcomes, what we expect would be the various supply chain concepts that are being used currently in the organization, and the kind of awareness and training the employees working at different levels of the healthcare organization possess about the supply chain activities. The second inquiry that we suggest is the purpose of supply chain activities. What various supply chain activities that are being undertaken in a given healthcare organization, what purpose it is serving. So the objectives being achieved by a given by a given supply chain activity, and the quality matrix which we are using in order to assess the performance of every given supply chain activity. So these will be the outcome of the second inquiry. The third inquiry that we suggest is the challenges in the execution of the supply chain activity. So what challenges are we facing while executing the given the given supply chain activities in a given healthcare organization? So that will highlight the response to this inquiry will highlight issues or weaknesses which prevents the progress desired to be achieved in a specific part of the supply chain system, and the impact of these shortcomings on other related supply chain activities. The fourth inquiry that we suggest is the level of collaboration amongst the supply chain partners. What is the level of collaboration? We would like to inquire about around this particular topic also, while understanding the current supply chain system in a healthcare organization. And by this inquiry, we would like to highlight the various stakeholders who feel that they are at a disadvantage or the various stakeholders in the supply chain who feel that they are at the receiving end of improper collaboration in the entire healthcare organization supply chain. So once we have made these inquiries and once we have the outcomes, then once we have the outcomes, so as a result of the second outcome, which is the purpose of what all quality metrics which we are using currently, once we have that, then we would like to branch all those quality metrics that we have made a list of by this interview for a given healthcare organization under the various sections of the quality dimensions. For example, if we have altogether 10 quality matrix being used by a healthcare organization, suppose 3 of them are measuring the performance and 2 of them are measuring the reliability, and another 5 of them are measuring the features for a given healthcare for a given supply chain, for a given healthcare organization. The rest 5 dimensions are not being covered. So this is how we will highlight or identify the dimensions of quality around which we must include some more quality metrics. So this is how we are planning to identify which are the areas around which we must include more quality matrix. And having done that, next the new quality matrix that we will develop or the current quality matrix that we have, how we will modify them, that will be taken care of by the perspective of the balanced scorecard. The balanced scorecard perspective, we have 4 of them: the internal business perspective, the patient's perspective, the financial and social perspective, and the learning and growth perspective. So for example, let us assume that the durability or the serviceability or the aesthetics, these are the areas around which we are currently not measuring the performance of our supply chain. So if we in future decide to measure or come up with some more quality metrics, then these are all the perspective that we will take into consideration, and we will, for example, perceived quality would. If we are trying to develop a quality matrix around perceived quality, then we will take patient's perspective into consideration, and the quality matrix that we will develop will focus around functions like availability, accessibility, trust, etc. So once we have, so it is a stepwise process. First of all, we inquire what are the current supply chain activities. Once we have inquired the current supply chain activities, next we identify what are the quality metrics currently being used. Then we identify what are the quality dimensions which are currently lacking or not being used in the current system. And then in the next step, we go on to define new quality metrics. And while we are defining the new quality metrics, the various perspectives that we are keeping into consideration are given by the balanced scorecard. Now, once we have done that, we also have suggested that the new quality matrix that we have developed should be constantly checked along with the feedback, the continuous feedback that we are getting. For example, from the 3rd and the 4th inquiry, we were getting the issues and the grievances of unsatisfied stakeholders, as well as the challenges being faced in the execution of the supply chain management practices. So these feedbacks, what we are receiving, would serve as a check for the current quality metrics that we have developed. Are they performing well or not? And then accordingly, for all the feedback that we are receiving, we would accordingly modify the given healthcare quality matrix. So this is how the overall framework would look. And in the process of analyzing the feedback, what all new supply chain innovations and tools are available, what all new technological tools are available. We will make a list of that, and we will try to incorporate that into the system. And at the same time, the public policies, because healthcare is a sector where the public policies of any given country plays a major role, and the regulations which the government brings in, all that plays a major role. So these new innovations and the regulations that are currently developing in the day-to-day exercise, all that we will include so as to counter the grievances that are being faced in this entire process. And accordingly, the quality matrix will be developed in a dynamic process. Now we are yet to implement this entire framework with a given healthcare organization. We have already started working on it, and in future, we think of implementing this entire exercise at a given healthcare organization and share our results with the academia. The decision points, I would like to finally highlight what would be the decision points. So the first would be the dimensions of quality. We will identify the missing ones. We have 8 generalized dimensions of quality given by Garvin, and all these 8 generalized dimensions of quality, how they can be adapted in healthcare sector was given by Smith et al. Later. And now what we intend to do is, as I discussed, identify the dimensions of quality that are not being covered currently by given healthcare organizations. Now, once we have done that, the next is we need to identify the challenges that the current supply chain activities are facing, and around those challenges, we will prepare the list of corresponding technical tools which can be helpful in solving those challenges, choose the best one out of it, and suggest strategic reforms for improving the collaboration amongst the various stakeholders, so that the ones who are unsatisfied, they feel more satisfied. And for all, and these are all the broad highlights along which we tend to develop the new quality matrix in our framework. Others are the regulations and benchmarking. So as we discussed in the earlier slide, the rules and regulations and the public policies that government is taking, we tend to involve them and make quality matrix around them, so that we can minimize to as much as possible the unsatisfaction that is there amongst the various stakeholders, so that the efficiency of the entire supply chain improves. And this is how we will try to modify the current list of quality matrix in a dynamic manner. So eventually, I would like to, in my conclusion, sum up the entire presentation and the entire research idea that we are proposing in this paper. Through this study, we have proposed a framework for measuring supply chain quality based on balanced scorecard concepts after understanding the existing supply chain quality measurement process for a given healthcare organization. Once we have done that, we propose a set of inquiries, outcome to which would give us a clear-cut idea about the level of awareness pertaining to healthcare supply chain activities amongst the employees of the healthcare organization, quality matrix being currently used to measure the performance of the healthcare supply chain, challenges that healthcare supply chain managers come across while executing the healthcare supply chain activities, and fourth, the level of collaboration amongst the various stakeholders in the healthcare supply chain. So once we have a clear-cut idea about these, I think we propose that we will be in a state to understand the current healthcare supply chain system for a given healthcare organization. Once we have that, next we propose to dive in further to identify the dimensions of quality that are being ignored in the current quality measurement system. And once we have identified this flaw or the gap, next we propose to improve the healthcare supply chain quality measurement system by using a continuous feedback system and strategies as suggested by the balanced scorecard management tool. So these are the references that we used in this presentation. Thank you. Thanks a lot.
Thank you very much, Pratik. That was a very interesting presentation, actually. And many of these supply chains for healthcare organizations have been seriously disrupted given the coronavirus pandemic. We've been working with several companies here in Norway, actually, that have experienced this firsthand. And I mean, a lot of supply chains now are at best temporary, right? These are suppliers that haven't never been in this kind of market before, making emergency gowns and masks for your face and things like this. How do you think your framework would impact this kind of temporary or restructuring of supply chains on a temporary basis?
Actually, when we started this research paper, pandemic was not there. So obviously, this would be a great idea to include in the research paper. But if at all, I would like how this framework would help in such a scenario. As I told that we have a dynamic component in our framework, and as the situation or the scenario is changing, for example, in the situation of COVID, constantly the satisfaction level of patients with the current healthcare system would be varying significantly, and that can be observed, noted, and accordingly the supply chain can be modified. And obviously, we have suggested 4 inquiries. So with the help of those inquiries, we can highlight what are the dimensions of quality that can be explored in a dynamically changing world, dynamically changing situations. Yeah.
Exactly. No, that's interesting. And just to try and tie up together with the first presentation today from Tanya Torn. I mean, one of the companies here that's set up to deliver medical gowns to the healthcare authorities. They'd never done it before, and actually it was an issue from the customer side, and that the customer wasn't really understanding how they should communicate their requirements to the supplier. They were used to the medical supplies coming from a certified supplier overseas, and suddenly when you have to find another supplier, the requirements, it's a very testing thing for customers and suppliers. So I think just to tie that up with what Tanya Torn was presenting with the QFD on the customer needs analysis, it's interesting to see it from both sides of from the proverbial coin. Huh? Okay, thank you very much, Pratik.